I have the privilege of introducing a speaker who I've known for some years, Dr. Hal Sures, who's a urologist and a former president of the American Association of Pediatric Urologists. He's also the co-founder of Doctors for Patient Care, which you'll hear more about. He practices in Atlanta, Georgia. He's the chief of urology at Children's Healthcare of Atlanta and the assistant professor at Emory University. He has a significant medical executive experience as a managing partner of Georgia Pediatric Urology and is a former president of the American Association of Pediatric Urologists. He's also the vice president of the Georgia Pediatric Subspecialty IPA. And now, without further ado, Dr. Scherz.
Hello, I'm Dr. Hal Sures. I'm the founder of Doctors for Patient Care and the secretary of the Doctors for Patient Care Foundation. It's my honor and privilege to participate in the summit and have the opportunity to present to you via video conference. I'm sorry that I'm not presenting to you live today at the summit, but I'm looking forward to meeting all of you when I get to Keystone on Saturday. Dr. Dick Armstrong will handle the questions and answers following the talk. So the title of my talk today is How Physician Advocates Can Connect with Doctors and Patients. But before I get into that specifically, I think a little bit of background material is in order. I'd like to pose the question, who advocates for physicians and for patients? And why is it even necessary that these groups have advocates? There was a time when such questions were unnecessary and it was absurd to even bring this matter up. Patients received care from doctors, who in turn paid for their services that they received. It was a simple professional relationship and a straightforward business transaction. So why did all of this change? Well, it's been the progressive erosion of the doctor-patient relationship that was created by the third-party payer system. And that dates back decades. The institution of Medicare and Medicaid was the primary reason why this relationship eroded, and much of the care was paid for by the government. But even in the commercial area, that relationship has eroded over time. And there's been a transition with commercial healthcare from major medical to catastrophic coverage to first dollar paid out of pocket for episodes of care. And doctors became more and more acclimated to first acceptance of insurance, and then assignment of benefit, and finally discounted fee for service. And insurance companies during this time created a wedge between doctors and their patients by becoming more adversarial and confrontational and restricting coverage and benefits that they paid for these episodes of care, trying to transition more care costs into the patient arena. And along the way, there have been a number of attempts to further erode the doctor-patient relationship, mostly implemented by insurance companies and others by the marketplace. HMOs are a perfect example of trying to limit the amount of services that doctors were able to give to patients. And capitation was another example how they tried to do that as well. In the business community, Wall Street has tried to squeeze profits out of physician practices back in the 1990s when there was a rush to purchase physician practices and suck out profits, and that usually meant less care to patients. And that all of these attempts to try to limit the care that patients received from their physicians were rejected by the marketplace and went belly up. So the erosion of the doctor-patient relationship continued mostly by implementation of government regulation. And these were ostensibly created to protect patients. But in instituting these restrictive programs and increased regulations, it increased the cost of care that doctors were providing by increasing their overhead. Doctors had to assume the costs of these government-mandated programs. And it also reduced competition, which increased the costs in the system in general. And most people are familiar with many of these regulations, beginning back in the early 1960s with certificate of need laws trying to keep doctors from opening up hospitals. This began in New York and quickly spread to 35 states, which currently have certificate of need laws. The government instituted anti-kickback laws and safe harbors in attempts to try to keep doctors from becoming entrepreneurs, as were the Stark laws a decade later. The government implemented other regulations such as OSHA, which was initially started as a way to protect workers in the workplace, but was quickly adopted and adapted to medical practices. And many of us who operate laboratories know about the OSHA regulations that we have to adhere to. And then, of course, everybody hearing this is familiar with the HIPAA laws, which changed the way that we handle reporting patient information in our practices. Doctor practices were also affected by other non-governmental or non-insurance company-based factors that changed the way that we practice medicine. The medical liability system is a perfect example, with the risks to physicians from their patients because of predatory laws that protect patients at the expense of physicians. And this has resulted in defensive medicine, which accounts for a quarter of all the medical costs in the $3 trillion annual healthcare economy. Our medical societies have become very restrictive of physician practices in the form of recertification and maintenance of certification, and I'll get more into that a little bit later in the talk. And then competition with our non-physician healthcare colleagues, such as nurse practitioners, PAs, CRNAs, chiropractors, optometrists, physical therapists, estheticians, just to name a few. The most significant challenge to the physician-patient relationship, however, came in 2010 with the passage of the Affordable Care Act, or Obamacare. The high-tech law, which actually preceded Obamacare and was part of the stimulus package, codified and put into place the requirement for the use of electronic medical records in all doctors' offices, and it created the concept of meaningful use to try to make that happen. There were limitations on physician ventures, such as the creation of outpatient surgery centers. Physicians who were accepting Medicare could no longer open these outpatient surgery centers. The shift in power to hospitals was encouraged by promoting accountable care organizations and changing the means of reimbursement to episodes of care and bundling the payments so that hospitals could control the flow of dollars coming in for caring for patients, and creating mechanisms to shift costs and responsibility to doctors in an attempt to reduce reimbursement, such as pay for performance and creation of Washington-based metrics tied to reimbursement. ICD-10 is set to be implemented in October of this year, and that will have a profound effect on physician practices. And then the rise of physician employment by hospitals, which is resulting in the decimation of private practice in this country. Now, 35% or less of the physicians practicing are currently in private practice. So after raising all of these issues about how physician practices are being challenged and the physician-patient relationship is in jeopardy, who is looking out for the interests of doctors in the creation of all of this? And the answer is no one. In 1964, the AMA was a very powerful organization. it protected the interests of doctors. And there were many attempts to try to create a single-payer nationalized healthcare system prior to 1964, which the AMA was successful in putting down. But then 1964 was the time that Medicare was passed, and everything changed. And up until that point, the AMA was very conservative. They had spokesmen like Ronald Reagan as their spokesperson, and 75% of the doctors in the United States were members of the organization. After the passage of Medicare, the influence and power of the AMA began to diminish, and leadership slowly moved further and further to the left and away from the interests of doctors. A large part of this move stemmed from the AMA's interest in protecting their monopoly in the CPT coding system, which was owned by the AMA and still is, and is allowed to operate by the federal government as a monopoly. And as such, they are beholden to the whims of the government to continue to maintain this monopoly, which accounts for the majority of their revenue. The AMA was successful in preventing the passage of Hillary Care in 1993. The AAPS was an ally in that fight as well. But since the 1960s, the membership in the AMA has dwindled, and now only 8 to 12% of actively practicing physicians in this country are members of the organization. Specialty societies claim to represent their respective constituencies, but the problem with this is that they have tunnel vision. Specialty societies have been divided into tribes, if you will, and so this marginalization was done intentionally so that power that the physicians hold could be diffused and no one group is speaking for the physicians. And in addition to that, there's some question now about the true motivations of the specialty societies with regard to representing their constituencies. The concerns come from the information that has become public information about money that has been raised from maintenance of certification and recertification programs that they promote, and have worked with insurance companies and hospitals at making sure is instituted and codified. And there was exposés in Newsweek magazine by Kurt Eichenwald, which enumerated the problems with the American Board of Internal Medicine and the ABMS boards in general, and the obscene amount of money that the people at the top of these organizations bring home. State and local medical societies claim to be looking out for doctors, and many do a good job at the state level, but unfortunately, many of the issues that doctors face today are at the federal level, and so the impact of the state and local medical societies is limited. There were doctor organizations that have tried to step in and replace the AMA. Their impact has been negligible over time. The AAPS is the largest and the oldest of these organizations, forming in 1943, but there have been problems with the AAPS, mostly from much of their libertarian positions, and so their reach has not been very wide in the physician community or the community of patients in general. Docs for Patient Care, which was the organization which I founded in 2009, was a little more moderate in positions, and we had created positions that were well received by policymakers in the political class, but the problem with Docs for Patient Care was that of money and reach, and so the membership organization has been transitioned into a foundation so that sources of income to help increase the reach of the organization to the general public and to the physician community as a whole have been undertaken. There are other organizations that have claims of representing physicians. Some are on the other side of the political spectrum, like Doctors for America, which are very left-leaning doctors that are more interested in social positions than in protecting doctors or the doctor-patient relationship. And their concerns are those such as single payer or universal coverage, or even things that have no bearing directly on healthcare, such as repealing gun laws. There are a lot of other smaller groups that have sprung up and have been effective spokespeople on individual bases, but nothing on a larger scale, which is why I suppose this summit has been convened. So which groups are adversarial to doctors and to patients? Well, with healthcare being a $3 trillion annual economy, there are many groups with many interests trying to increase their share of this healthcare pie. And those include hospitals, insurance companies, healthcare IT companies, pharma, medical, specialty societies and the AMA, non-physician healthcare providers, and trial attorneys. And all of these groups have the same thing in common: lots of support from their constituents in the form of money. And that has brought them immense political influence over the years. So now finally to the heart of the question and the talk. How can doctors fight back? Well, you must advocate for solutions that make sense. As an example, the Docs for Patient Care prescription for healthcare reform lists common sense solutions for healthcare reform that have been well received across all spheres and circles dealing with healthcare. Find doctors who are willing to do the heavy lifting and support their efforts, such as the Docs for Patient Care Foundation, or the AAPS, or the Benjamin Rush Institute. And this means opening up your checkbook. Support these groups and the work that they're doing. You have to get away from the notion that your money is not well spent by supporting these groups, or get away from your notion that you're already giving money to your state medical society or your specialty society, because that clearly is not enough. Talk to doctors in your medical groups, at your hospital, in your social circles, and pick an area that you feel passionate about and promote it and become an agent of change. So what are some of these areas? Well, the big area, of course, is repeal of Obamacare. But that is a broad area. So you can pick a smaller area, like the promotion of direct primary care, or repealing the certificate of need laws in your state, or tort reform, or maintenance of certification. These are all excellent ways where you can focus your energy. Get to know your state representatives and also your U.S. representatives and senators. Go visit them and support them. You may not always get them to vote the way that you want, but if you educate them, it may surprise you how they vote. The latest repeal of the SGR, which had in it terrible provisions about physician reimbursement and changes in oversight from Washington, was something that nobody talked about. We tried to educate our friends in Washington, and we were able to get Ted Cruz, Marco Rubio, David Perdue to vote against it, just as we were many of the people in the House of Representatives. There will also come a time when you can call in a favor, especially if you hold a fundraising event at your house with your physician colleagues. Become active in your state medical societies and discuss issues with friends who are already active at that level. Many of the medical society initiatives go to the state representatives for the next legislative session, and there's a greater chance of these issues being advanced if the state medical society is behind them. Write opinion pieces in your local newspapers and do so with regularity. Submit pieces to online internet sites such as American Thinker. These pieces become viral quite often, and I know that from personal experience, and it takes on a life of their own. Call into local radio shows, or if you're so inclined, into national radio shows like Dr. Marty on the Bill Bennett Show. Share your views. Make it well known to people in your community that you're doing all of this, and become the expert or the go-to person in your local community for TV stations or in other media circles on healthcare issues. Get involved with the Public Policy Foundation in your state. They are looking for doctors who have an understanding and an interest in the issues, which pretty much means all of you. And they are a very important resource for getting help in fighting for the issues that I've already mentioned at the state level. So who are our allies? Well, patients are, as are businesses and employers. And I'm not advocating for the connection of employer-based insurance, but many employers, many businesses want to provide healthcare benefits to their patients, and to their employees, and they should be allowed to do so if they so choose. And I'm not saying tying it to it, but if they want to offer it as a perk, that's certainly their prerogative, and it's the number one cost on their balance sheet. And business is an ally that we must team up with to fight back against all of the well-funded interests that I've already enumerated earlier. And this is already being done. In Florida, the president of the Docs for Patient Care Foundation, Lee Gross, has teamed up with the NFIB, the National Federation of Independent Businesses. And they learned about direct primary care from Lee, who runs Epiphany Health. And they were able to promote this at the state level, spending millions of dollars to make sure that it got on the legislative calendar in Florida. Reach out to your patients and teach them. They already are our allies and they're behind us. Give them the ammunition that they need to be the army that's necessary to fight for healthcare freedom and the preservation of the doctor-patient relationship. Printed materials are important and patients love them. Take the time to reprint anything and everything that explains to them what's happening to their healthcare, or create your own source material. Give them things to do. Create a website with information on it if you're averse to having this information in your waiting room. Blog, tweet, Facebook, share all of the information and all of your concerns with your patients via social media. Speak at patient functions and political events. Go to Rotary clubs or to men's clubs or women's groups at churches or synagogues. Contact Tea Party groups in your area or the local chapter of Americans for Prosperity or other groups that are fighting to stop the increasing involvement of government in our lives. These people want to learn and they want to do something. They're activists. Doctors may be beaten down and disinterested, but patients aren't. When enough patients demand from their doctors that doctors become more involved, they will be. But most important, you must stay upbeat and hopeful. You must put the patients first and not think about how healthcare is affecting you or your practice. If the patients are put ahead of everything else, all will work out. You must talk to doctors and give them hope. Don't be discouraged by their lack of interest or their lack of involvement. They have been beaten down so much for so long that they don't have the strength to fight anymore. But all it will take is one or possibly two victories to re-energize them. So approach things with this in mind. There will be an alternative healthcare delivery pathway. There already is. And doctors must fight for them at the state level. And when these are adopted, the federal government will come around. There already is a groundswell of support for healthcare consumerism. And we need to be the ones at the forefront guiding these efforts, not businessmen, and certainly not politicians. And with that, I'm going to stop, and I'm going to thank you again for allowing me to present to you how doctors can fight back and advocate. And any questions that you have, I know will be amply answered and probably handled better than I could by my colleague, Dick Armstrong. Thank you for listening, and I look forward to meeting all of you at the summit on Saturday.
Thank you very much, Dr. Scherz. That was a very eye-opening presentation with a lot of great action steps. Thank you very much. and appreciate your work with Doctors for Patient Care. And speaking of Doctors for Patient Care, I have the privilege of introducing to my side here Dr. Dick Armstrong, who is the General Surgeon. He is the Treasurer of Doctors for Patient Care Foundation, and he has worked with Dr. Scherz in that organization since 2009. Welcome, Dr. Armstrong.
Thank you very much. Nice to be here.
So if anyone has any questions, we'd be glad to take them from the floor or from the internet, from the web at this time. All right, I have a question for you.
Okay.
What do you consider the most important action step for a physician or a patient, for that matter? So it's sort of two questions to take at this time.
I think probably being open to being educated about where we are in American healthcare, and that's really why we're here and why we exist. And I think that probably one of the things Hal said at the end of this, which is most important, is that we do not give up hope. For the last several years, there have been lots of reasons for doctors to be angry, and that they had justifiable reasons to be angry. But honestly, I would say to all my friends in the webcast here and here in the room, it's time to get over your anger. And it's time to look hopeful and look to the future for things that we can do. We have already seen some small evidence that we're making a big difference. Direct primary care, which is growing in the nation, was embraced by us in 2011 when we first invited Dr. Lee Gross to come to Washington to one of our meetings and present his epiphany idea, which literally blew people away and still does. And we need to reach across party lines. We need to get rid of the partisanship, get rid of the politics, and start to work together to change things. One of the nice things about direct primary care that I would have to say about Dr. Gross is he did a recent presentation to the Florida legislature, and we have it on video. One of the Democratic representatives in Florida stood up in the legislative session and said, "This is the best thing that I've heard, period, since I came to Tallahassee." That's what we need. We need hopeful models. We need action, like Dr. Craviato said earlier this morning, and we need to be the leaders that the nation expects us to be. And that means we need to heal the divides, heal our differences, come together like here, and move forward with a positive message.
That's very encouraging. What would you suggest for the second part of my question with regard to what would be a primary concern for the patients? What action steps could they take?
Well, I think that the patients are beginning to learn in this new era since the Affordable Care Act passed that they are going to expect to be more involved as consumers of health care. We see this with high deductible health care plans. We see this with the high deductibility of the exchange plans. And so I think that as patients, they need to start to learn to take control of their health care consumer responsibilities. They need to learn that the economics of health care don't live out on an island, like David Goldhill says. They live here in the United States, right on the mainland. And I think when they become more empowered, they'll be happier with their health care.
Where do you see the activism that doctors are undertaking and patients undertaking as well? Where do you see those actions going over the next 5 years to decade?
Well, I think we've
got work cut out for us.
I think we have our work cut out for us. We have to change the mindset of an entire nation of people who've been taught for over 70 years that they don't need to be concerned about the actual cost of their health care or the economics of the physician-patient relationship. That needs to change, and it's going to be a long, tough road to change that. But I think that as we develop models, like the Uber taxi system has developed a model, as we develop models that work in the market and that patients like, and as we develop models that are excellent, like many of the people in this room have done and many of the people that we've talked about have done, the patients will begin to understand and be pleased about it.
Great. In the remaining 2 minutes, Dr. Lisa Chu, did you have a question?
Yes. Hi, Dr. Armstrong.
Hi.
It strikes me that one of the themes that's emerging from this summit is the key role of the doctor as educator, not only of other doctors, but of our patients, And one of the things that Dr. Scherz mentioned that struck me was understanding the value that doctors are creating, not only for their patients, but for businesses. So what would you say is a good way for doctors to really begin to understand the value that we are creating for all the stakeholders?
I think that's an incredibly important comment, and I'll just say quickly that doctors, and Michael Strickland hits the point very hard, and that is we train for many years to do what we do, and we are professionals at what we do. We have incredible value. Doctors need to embrace the fact that they have that value and learn how to communicate that value to not only their patients but to the rest of the public. And we need to get that message out. And doctors need not be embarrassed to actually make a living doing what they've learned is valuable during their training. We don't need to think of our businesses, which have to create a profit to feed our families, as anything to be ashamed of. Dr. Cavalli.
Yes. One of my observations has been from learning from my patients. And as a lot of organizations that deal with, I don't want to use this word, but I have to use it, addiction. One of the first steps is to accept the addiction. And most of us in this room and probably on the have gone past that level, but the majority of doctors have not. And I feel very strongly that as a group we have to address our addiction to third-party payment system. And once we address that point, then we can ask the question, how do we move forward from that? So what is your suggestion for us to engage in that conversation with our colleagues?
Again, I think that probably the key point is education, Arvind, and I think it can happen everywhere, and that's why we are what we are. That's why we transitioned our efforts from doctor-patient care to a foundation. That's why we're building what we're building to become an educational hub for America, for both our colleagues as physicians, patients, and the rest of the nation.
So keep talking and start acting. Thank you very much. I appreciate it, Dr. Armstrong.
Thank you, Dr.
Thanks for being with us. My pleasure. We'll give you one of these. There we go.
All right.